I'm Dorothy Pardalis from Windsor, Ontario. I think that most pharmacists can relate to our patient Samantha. Although you may have seen a patient like her in your practice, she is a fictional case and may or may not be representative of the general asthma population. Let's take a look at the case. We have a 19-year-old patient who is in to pick up a refill for a fast-acting beta-2 agonist after only 25 to 30 days. When you look at her profile, you notice that it has been 90 days since she has refilled her inhaled corticosteroid inhaler that she uses twice daily. Here are some key points to consider. She first mentions that her asthma is well controlled, even though we can see from her refill history that she is using the salbutamol multiple times daily. She states that she is doing so much better than she used to be. This shows that she feels that her daily asthma symptoms are completely normal. She states that she can do almost all of her regular activities, indicating that there are some activities that she cannot perform. She feels that her inhaled corticosteroid does not do anything to improve her asthma, and she is forgetting the second dose because of her shift work. She also states that she is worried about steroid-related side effects. Clearly, we can see that this patient's asthma management is far from optimal. Looking at the Canadian Thoracic Guidelines, we can see that her asthma is not controlled, since she has The guideline recommended treatment continuum suggests intensifying therapy in a patient with uncontrolled asthma. Samantha has been prescribed an inhaled corticosteroid, which is the recommended treatment for a patient who is not controlled with fast-acting bronchodilator therapy. Although her currently prescribed therapy is appropriate, the primary issue is that she is not adherent. The first thing to do with Samantha is discuss the importance of asthma control. Her symptoms are not normal, and experiencing daily symptoms is far from optimal. I would also stress the importance of adherence to her inhaled corticosteroid therapy and have a fair and balanced discussion about the benefits and risks of inhaled steroid therapy. Samantha also mentioned having a problem with the second dose of her inhaled corticosteroid. To ensure adherence, the guidelines recommend that we focus on making the patient comfortable with the safety profile of her medications, using treatment strategies that are simple and having fewer medications taken less frequently. I would recommend exploring the adherence further, and if she is having trouble with the device or remembering to use her inhaled corticosteroid, we could suggest using a different device or looking for a therapy that is taken less frequently. I can't stress enough how important it is for pharmacists to intervene with patients like Samantha. With some education and potential changes in her therapy, we can help to reduce asthma symptoms and improve both her daily function and her quality of life.